Good evening, and thank you so much for joining us on Joy Asonye Live here in KAFTAN Television. Well, today we'll be discussing Nigeria's healthcare infrastructure, challenges, opportunities, and reforms. Nigeria, the most populous country in Africa, faces numerous healthcare challenges. Despite being a middle-income country, Nigeria's healthcare system is plagued by inadequate funding, poor infrastructure, and shortage of skilled healthcare workers. The country also struggles with high rate of diseases such as malaria, tuberculosis, and HIV, as well as non-communicable diseases such as diabetes and hypertension. Nigeria has significant disparities in the access to healthcare services between different socio-economic groups, and that's what we'll be discussing on today's program. And to discuss all of this is Dr. Douglas Okor. He's a consultant neurosurgeon, Federal Medical Center, Abuja. He's also a Nigerian health sector reform advocate. It's wonderful to have you join us here.
Thank you very much, Joy, for having me. Thank you.
Well, at this moment, we'll just go for a short break and return to discuss in depthly. Stay with us. Welcome back. Like I said earlier, we'll be discussing Nigeria's healthcare infrastructure, challenges, opportunities, and reforms. And we'll be discussing this with Dr. Douglas Okor. He's a consultant neurosurgeon with the Federal Medical Center, Abuja. He's also a Nigerian health sector reform advocate. So, Doctor, I'll just go straight to something I've heard you repeatedly say. I mean, what do you mean in your advocacy for Nigeria's healthcare reforms? What do you mean by human capital in the healthcare sector?
So basically, first of all, I want to say a big thank you to KAFTAN TV and to you, Joy, for actually creating this, using your platform to actually advocate for healthcare. Okay, healthcare is a mainstream socio-political priority in places where they actually understand the value for human life. Okay, places like the USA, like the UK, European countries, Canada, Australia. Okay, they take the value for human life very seriously, and so they prioritize healthcare. Human capacity. When you're talking about human capacity, you're just talking about the healthcare workforce, right? The human resource for health. Okay, you know, all those people within hospitals, within the healthcare ecosystem generally. Okay, you talk about even from the porters, from the gate men, all the way to the radiographers, the medical lab scientists, the pharmacists who work in the hospitals, okay, the nurses, the midwives, the physiotherapists, and of course the doctors, the dentists. Okay, these are generally the healthcare workforce. So that's the human capacity within healthcare itself.
Right. And for some who will be listening to you and say you're advocating for that sector to be revamped, but we have the infrastructural decay in other sectors. Are you not asking for too much when you prioritize health? When we have education in there, we have the low poverty rates in there, we have like dire statistics of unemployed Nigerians. What would be your response to that?
My response to that will be that when you look at, for example, what we call the Sustainable Development Goals, there's a reason why there's development in it. Okay, so we also want Nigeria to develop, isn't it? So they now number them from 1 to 17. Okay, and that numbering is based on what's really important. Number 1 is about ending poverty. Number 2 is about reducing hunger. Guess what number 3 is?
Healthcare.
Guess what number 4 is? Education. So education is extremely important as well. In fact, one of the key things I always say that governments who are serious about the people in a country need to invest in 2 things: healthcare and education. They're extremely important. If you actually throw a significant amount of your resources into healthcare and education, guess what? You will pull millions of people out of poverty. You just talked about poverty.
Yes.
If you invest in those two key areas, you will pull lots of people out of poverty. I'm telling you, you have this very staggering statistic of 133 million multidimensionally poor people in Nigeria. 63% of our population. That is significant. You talked about Nigeria being a middle income country. I do not think so. Nigeria is a low income country when you actually look at per capita.
Okay, right.
When you look at the GDP and look at per capita and stuff like that, and when you look at the Gini coefficient, for example, when you look at how the numbers of people who are actually linked into and very economically viable things that they're doing and stuff like, or when you look at things like the unemployment rate and the underemployment rate as well. Nigeria is a low income country. You have significant numbers of poor people. Investing in healthcare, you need to invest in a lot of things. In sectors in the country
simultaneously, of course,
absolutely.
To get it moving.
But I am saying that healthcare is one of them that you must take really seriously. The way Nigeria is now, okay, in the last couple of years, we've gone really down in terms of all our indices, looking at all the sectors. Okay, there are 4 key sectors that we must prioritize at this particular point in time. They are healthcare, of course, education, power. In terms of infrastructure, power is the most important thing at this particular point in time, okay, and also security, because of all the issues. So healthcare will always be in there, okay, and we are looking forward to a time when you will have governments in Nigeria at all levels, be it at the federal level, at the subnational level, i.e. the state and local governments, that will really start truly prioritizing healthcare and putting their full muscle behind healthcare. Of course, there are other areas. They need to put muscle in all these areas, but I'm saying healthcare. Remember, you introduced me as a healthcare advocate, isn't it?
Exactly.
So that's where I'm putting my muscle. There are other people advocating for education as well. There are people advocating for what they call it, for infrastructure that we really need at this particular point in time, and of course for security as well. Okay, my trust is actually healthcare, so I will advocate for healthcare. And truly, okay, if you truly want to, in terms of actually pull people out of poverty, raise, build your economy, significantly make a dent in your human development index and stuff like, you must spend money, put resources into healthcare. Very important, Joy.
Let's look at the Nigeria's healthcare infrastructure at the moment. What are these indices you would like to see? I mean, there's a new administration coming. What are those indices that will give you that hope or optimism that we are indeed at the right path?
I think, first of all, you use the word infrastructure, but I will sort of broaden that to say the healthcare system. Okay, so it's a system, and it's a very complex system, and it's a system that also, that dovetails and intertwingles and whatever, with other systems as well. The healthcare doesn't stand alone. Okay, now there are different components of a healthcare system. Okay, we should break them down. Okay, just to say this, the Nigerian healthcare system is an extremely weak healthcare system. Okay, so it needs to be strengthened. Now, the components I talked about, first one is leadership and governance. Okay, second one is funding and financing. Third one is what we talked about the first time, the human capacity, the human resource for health, the health workforce. The fourth one is actually healthcare service delivery, the services itself, providing the services. Fifth one looks at things like the health information systems, data, using technology and all that. And of course, the last but not the least is actually looking at medicines, vaccines, and consumables that we actually use in healthcare. I like adding a seventh one, which is research, auditing, monitoring, and evaluation.
That's just as important, actually.
Absolutely.
Exactly.
Okay, so those are the components. So I want to see governments who, first of all, they show in their body language, in their posturing, that they understand this, that healthcare is important. That when the United Nations pulls together what we call the Sustainable Development Goals, and they put healthcare as number 3, that they actually know why they're putting it as number 3. Okay, they know that for any country to actually develop properly, you must have a healthcare system that has some semblance of at least some basic quality and safety within that space. Okay, so first thing I want to see governments doing at all levels, especially we are going to have a new government coming in.
Exactly.
in a couple of months, isn't it? So the first thing we want to do is for them to show that posturing. We want them to move swiftly and straight into action. Okay, We want a situation where, for example, at the national level, you're having a minister of health straight up, you're having a minister for state for health straight up. At all the state levels, you're having the commissioners of health and all that, okay? And we now want them to, we now want a strategic meeting with all these players, okay? At the national level, the subnational level, and coming together and actually having some sort of emergency strategic meeting where they actually say, hey, healthcare is an issue of national concern. I don't want to say national emergency, but it's an issue of national concern. And where they can actually pull together and in simple language, just put out the strategies of how they're actually going to deal with these components that I've actually talked about. Because all these components are very important. We must deal with them. And then the reason why they must all come together is that we want an integrated healthcare system. We usually call that healthcare under one roof. Okay, our system is really fragmented. You have the state governments doing their own thing in one corner, the federal government is doing, the local governments are trying to do some sort of push some sort of primary healthcare, not really succeeding. Okay, so we want that sort of integration. We want to see governments, especially at the national level, really focusing on really strengthening our institutions. We have this thing we call the NDAs, isn't it? The ministries, departments, and agencies, really strengthening them and making them fit for purpose. Okay, making sure that all the human beings that you're putting in there, that you're employing there, that they are well trained, making sure that you're creating that space in terms of the infrastructure and stuff like that, and also making sure that you're throwing in technology. It's really important. Okay, all the institutions, the MDAs within healthcare, okay, and the ones that actually support healthcare as well, but specifically things like the regulatory agencies and the regulatory bodies, we want them strengthened, because one of the key things is that you want a healthcare workforce, okay, that is at par in terms of when you look at things like the knowledge base, the competence, the skill, the experience, and stuff like that. And if you have robust accountability mechanisms within the regulatory frame and regulatory space, okay, that actually helps. Okay, so those are some of the things I want to see them doing, and I want them to actually be focusing on these key issues and these four things that are clear: leadership and governance. Okay, we want to see governments, president, minister of health, minister for state for health, governors, commissioners of health. We want to see them truly, okay, acting like they are serious about actually providing the fundamentals of healthcare for Nigerians. We want good governance. Providing healthcare for Nigerians is part of that good governance thing that we keep talking about. Okay, of course, we have the National Assembly as well.
Of course.
Okay, we have the National Assembly. Recently, in the last week, within the last week or so, there's been this bill that was thrown on the floor of the House of Representatives, where they were talking about, they picked a particular healthcare category. Right. Okay, and we're talking about that these particular healthcare workers, that they seem to be living jackpine, as we say in local parlance. Exactly. Okay, that they seem to be jackpine, and they want to actually try and create a law that makes them stay 5 extra years before they get their full registration, so that they can actually show some commitment, because their training in the public health institutions was subsidized and stuff like that. And for me, it was a little bit heartbreaking. Really heartbreaking, because clearly you could see that when it comes to that actually show of that fundamental basic intellect, where you say, these people are actually reasoning, they are actually, you are thinking out of the box, they're actually doing the right consultations with the right players and stuff like. You could see that was not done. It was just a knee-jerk reaction. Okay, and it's almost tending towards being disgraceful. I won't lie to you. We want to see governments in the executive arm of governments at all levels, and also the legislature as well, really understanding that healthcare plus all the other sectors, I keep repeating that it's not just healthcare, that they are showing them that they understand the importance of these things, and they are truly ready to actually sit down, think strategically, okay, put things in place in terms of white papers, legislations, laws, and stuff like that, and actually have the oomph and the political will to actually deliver these things to the people, and actually have mechanisms for monitoring and evaluating whatever they're doing as well. This is extremely important. That meeting that I talked about, this sort of emergency meeting that should happen, okay, when the Senate and the House of Reps, when they are actually sworn in, the 9th Senate, 10th Senate, when they're actually sworn in, of course, they're going to have Senate committees and House committees on health, isn't it? Of course. Okay, they should be part of this meeting. This meeting I talked about, where you have the nationals and subnationals coming together, okay, it should happen within the first 4 weeks. Right. After 29th of May.
But let's backtrack a bit. I mean, the elections, in the build-up of the elections, we did not see this kind of passion as to interrogating those who were at the pedestal to be voted. on their healthcare plans for Nigeria. I mean, we were swayed by conversations, in my opinion, that were not very necessary. I mean, I would have expected that the unions in the healthcare sector or stakeholders in the healthcare sector that understand the challenges Nigerians are facing would be more intentional, because you can't hold a man to something he did not tell you he was going to do. You're expecting so much from, especially this 9th Assembly, and of course you did not interrogate them, and the 10th Assembly is again coming on board, and we saw how the elections went. I read all the manifestos, I read all the action plans and all that. I not personally was not very satisfied with where healthcare was placed. So are we not crying foul already?
In terms of holding our leaders to account at all levels, it is never too late. Okay, in terms of the kind of motion, the type of involvement and engagement would have expected from the key players, like you talked about, the healthcare professional associations, even civil society and all that. I always try and draw the
exactly.
I try to draw the Nigerian Bar Association in as well, okay, because they are a very strong body. Did we get enough? We did not at all. Okay,
is there a reason why?
It's because let me put it this way. You know, the political elite are like the daddies and mommies, okay, which is of the people. So somehow the attitudes of the people seem to reflect whatever the people in the political class, whatever they sort of put their energies and show that is important. That's what they sort of set. They sort of set the pathway for what people will discuss and stuff like that. So I can tell you that the average Nigerian, okay, also does not think that healthcare is a super priority. Okay, they know it's important, but they don't think it's a super priority. The average Nigerian only remembers, healthcare when they run into trouble, and that is the truth. Okay, even the discussion about healthcare to many people is boring. You know that. The discussion about healthcare is boring. If they were talking about one particular politician that did something, or the politician who stole money or something like that,
when you sensationalize
or maybe the snake swallowed money, or termites ate some money or something like that, or someone actually stole 9 billion naira in one of the. So those things are more sensational. People want to talk about those things. Healthcare, even me, I would like to. Healthcare is a little bit boring. Okay.
Wow, coming from you.
I'm telling you, it's a little bit boring. That's why somehow I try and spice it up, probably with my personality and stuff when I speak like that. So the key thing is that even the people themselves, they have not come to that place where they themselves, the average Nigerian person, where they understand that healthcare is actually really, really important. And that's why we, like you rightly said, it's sad that all the healthcare professional bodies and all the other key players, we should be expecting more from them when it comes to the advocacy and the pushing and the holding and actually creating those platforms and having that sort of stance of trying to actually put governments at all levels under pressure. Exactly. Okay, and actually hold them to account with respect to delivering a healthcare system that is what is all that we can all be proud of. So yes, I totally agree with you.
Okay, now that you've agreed with me, let's go back to the House of Representatives proposing a compulsory 5-year service for medical workers before granting full license. I mean, that has elicited several reactions from these key stakeholders.
It's sensational as well. It's sensational as well. So
exactly.
So in one way, I can say myself, okay, I like it. I like it that the healthcare has been brought to the fore.
Exactly.
But on the other hand,
but you should understand that there's no government that would not find it alarming. I mean, when we look at the statistics, it is said that in the UK alone, we have 77% of all the black people in the UK, in the medical sector in the UK, 77% are Nigerians. So I can understand why it should be concerning for a country, especially when we are talking about shortage of skilled workers in Nigeria. So what would you say a better policy should have been instead of this one in curbing the brain drain in that sector?
This knee-jerk reaction of picking just
one. That's your word.
Yeah, this knee-jerk reaction. It was definitely a knee-jerk reaction, very unintelligent. Okay, the key thing is this, like I said, healthcare is a system, okay? And I talked about the components, and one of the components was the human resource for health.
Right.
Okay? So we have a major big issue with the human resource for health, not with just doctors alone. Okay, so just picking one particular way is, like it's playing to the gallery. It's like not understanding them. Hey, no, there's fundamental issues. Okay, so what we want is governments of all levels, and including the legislature, so including the National Assembly and even all the state house of assemblies. We want them to take this issue of healthcare very seriously and go down to the fundamentals, to the basics. Okay, so question. What are we going to do about human resource for health? That's what they should have been asking in the first place. What are the strategies we should be adopting? First of all, go do some research, consultation, okay? Sit down with the key players, okay? And those key players, please make sure that you actually invite those healthcare people within healthcare that are Nigerians in the diaspora as well, because that is a massive pool of talent. Please get them involved as well, because those are eggheads. Okay, now when you do all that consultation and stuff, the next thing I expect government to do is working with all the key players, and like I said, the National Assembly being involved as well, because at some point maybe they might need to make legislations, bills, acts and stuff like that will actually support some of the things that need to happen. One of the first things that they need to do is that they need to do some mapping of the occupational categories within healthcare, okay, and actually collect data. Okay, that's what they need to do first. How many community health extension workers do we have? How many radiographers do we have? How many medical lab scientists do we have in Nigeria? Is that data not readily available? I should expect that with the professional bodies within the or professional unions, you should have that. Well, they should do a comprehensive one. Right. Okay, a comprehensive mapping and collecting data of what we have. That's one of the first things. Okay. Second thing that should happen is that you should look at your different levels of care. Tertiary level care, which is your federal medical centers and your teaching hospitals. Secondary level care, which is your state general hospitals that are run by the state governments. And then your primary level care, which is supposed to be run by the local government. Okay? And then you should now start envisioning, what do you need at all these levels? Okay? How many healthcare professional categories, how many do you actually have? How many nurses do you have? How many midwives do you have? Okay? Then you now start asking yourself, how many do you need? At least baseline. How many do you need? In terms of looking at, okay, in terms of looking at projections and stuff like that, how many can you create? Okay? And then also you now start looking at what environment in terms of conditions of service are you able to provide for all these healthcare workers? Okay? I didn't say doctor. I said healthcare workers. Okay, can you see the way I'm thinking about? I'm thinking about it as a system. I'm thinking about it holistically. I'm not picking one particular category. Yes, I'm not picking one particular healthcare professional and say, oh, you, I spent 5 years. No, you understand? But are we also having this, before you move on, are we also having this brain drain and this exodus from other all healthcare workers are leaving. Right. All of them. A-L-L. All. Okay, so can you see why it's very simplistic to speak about just doctors? Pick one particular healthcare professional and ask him and say, oh, this particular healthcare professional, in order for us to prevent brain drain, let's pick this one and let's do it, make a law that says they will stay 5 extra years. Okay, Dr. Douglas, it's time to call for a break now. When we come back, you will tell us why you who studied in the UK had to return and what your concept of brain regain is. We'll be right back after this. This is still Joy Asonye Live.
Wrapping up the day, unwind with the reminiscence of the day's news from home and abroad with KAFTAN TV 7 p.m. news.
Good to have you join us on KAFTAN News at 7.
Nigerians are living in abject 5%. Are young people brave, purpose, the harmony, symphony.
It's good to have you join us on KAFTAN TV News at 7.
We found that the 10 naira not actually sufficient.
National, foreign news headlines. Get balanced, accurate facts on the latest news in business, politics, entertainment, sports, and more. Live from our studios.
Many thanks for watching. Join us again at 9
KAFTAN
p.m.
TV News. While wrapping up the day, unwind with the reminiscence of the day's news from home and abroad with KAFTAN TV 7 p.m. News.
Good to have you join us on KAFTAN News at 7.
Nigerians are living in abject 5% are young people. Repurpose the Harmony Symphony.
It's good to have you join us on KAFTAN TV News at 7.
We found that the 10 naira card is not actually sufficient.
National, foreign news headlines. Get balanced, accurate facts on the latest news in business, politics, entertainment, sports, and more. Live from our studios.
Many thanks for watching. Join us again at 9
KAFTAN
p.m.
TV News.
This is still Joy Asonye Live, where we are discussing the Nigerian healthcare challenges, opportunities, and reforms. And we've been discussing this with Dr. Douglas Okor, consultant neurosurgeon, Federal Medical Center. He's also a Nigerian health sector reform advocate. We had gotten the conversation to the brain drain in the sector, and I want you to tell us more about your concept of brain regain, especially for somebody like you who studied in the UK and found your way back to a country where a lot of your colleagues are living.
Okay, for me, even before I left Nigeria, my plan was to come back. Okay, most people wonder, well, why did you become a brain surgeon? I decided to become a brain surgeon in my fifth year in medical school, and the reason was that I did my medical school, my basic medical training in University of Benin. Okay, and up until that time, roughly about 1999 or so, not one neurosurgeon in the University of Benin Teaching Hospital or in that institution. And so it was the lack and the space to create value that actually made me decide that, oh yeah, okay, I'm going to be a neurosurgeon. So you can imagine my classmates, how they looked at me. I was always in big parties, organized the biggest carnival in school then. So when I said I was going to be a brain surgeon, like, nah, and they all laughed at me. Guess who's laughing now? But anyway, for me, okay, it was always a passion for me to actually come back to Nigeria and actually give back to Nigeria and be part of the key players and be part of that generation that will actually help and push to actually revamp and reform the healthcare system in Nigeria. And so I kept to my promise. Okay, I actually came back. When I hit UK, I actually landed UK February 2006 to pursue my dreams to become a brain surgeon. And one of the key things I found out was that, okay, in terms of the basics, you know, the foundation of resources, the people, things in the ground and stuff like that. These guys, they don't actually have more than us, but all they just have is people who are strategic thinkers, who are strategic doers, who understand the value for human life, and who actually are really passionate about transferring issues on paper to actually reality and actually providing good governance for their people. Okay, they understand in that part of the world, in the UK, for example, okay, that healthcare is a mainstream priority. So even when they actually do their campaigns, okay, healthcare is one of the main issues that they're talking about. If you look at their budget for healthcare, you'll be looking at something like 250 billion pounds. Okay, so that's one of the first things. So I was like, okay, this place, yeah. On a good day, if we had proper governments in Nigeria, okay, proper people who understood the value for human life running our system, there are people round pegs in round holes, people who have people within our government space who are courageous, because you need courage to actually make change and revamp any system within Nigeria, who are courageous, who are motivated, who are passionate, okay, and who have the technical know-how as well. We could change things. And in my mind, I was like, hey, I want to be one of those people. who can actually, put some work on the ground and actually push that narrative and push that change that we actually want to see. And so I made that promise I was going to come back, and I actually came back. And touch wood, okay? Even within my small sphere of influence and the teams that I work with within Nigeria and stuff like that, Joy, we are making magic happen. Okay, one of the things I tell people that 85% of people who go outside Nigeria for complex brain and spine surgery do not need to go out. We are doing those things in Nigeria with good outcomes. But guess what? Even though these things, especially within the private sector, when I do private sector, even though these things are very expensive for the average Nigerian, they are significantly cheaper than going outside Nigeria.
They
significantly cheaper than going outside Nigeria.
With the medical tourism, are Nigerians aware?
Absolutely. But the key thing is that especially when you look at what I call the real private sector within healthcare, okay, within the last 15 years, they have done an absolutely fantastic job, Joy, when it comes to actually providing availability of complex care within Nigeria. Okay, and what is complex care? Complex care is not HIV, it's not malaria, it's not tuberculosis. Okay, it's things like kidney transplants, brain surgery, spine surgery. Okay, interventional radiology and stuff like that. Now, when it comes to individuals, groups, okay, some consortiums and so on, you already have them in Nigeria, in places like Abuja, Lagos.
Exactly.
There's some people in the southeast, in Enugu and Owerri, and these guys are actually providing top-class service. Okay, the average Nigerian cannot really access the service, but at least the services are available. Okay, you know, there are 3 A's within healthcare: availability of care, affordability, and accessibility. So accessibility and affordability we are still struggling with, but at least we have availability. So that means that those billions, about $1 billion that actually leave capital flight that actually leaves Nigeria for health tourism and so that, we can actually within the next 5-10 years actually significantly reduce that. Again, we need serious governments and serious players within healthcare to actually make that happen as well. So question, why did I come back to Nigeria? Because in the UK, I am one of the brain surgeons. In Nigeria, I am the neurosurgeon. Okay, touch wood, my presence within the country, whether you like it or not, has raised the bar. In terms of the standards of the kind of care that we provide for patients who have conditions that affect their brain and their spine. Okay, and that makes me proud. I'm proud of that. Okay, and you can see I'm not stopping there. Okay, that's why I do a lot of advocacy about healthcare in general for Nigeria. Okay, and I keep doing this for one reason and one reason only: Joy. The Nigerian patients are worth it. Okay, that's my slogan. The Nigerian patients are worth it. Initially, when I came back, when I used to use the slogan, some of my colleagues thought that, oh, you're just talking now. Maybe just political talk and everything. But guess what? Even in my own personal providing care for patients, I show it as well. Okay, I do what I say. Okay, and so that's for me. Okay. If we have more people thinking like this, more groups thinking like this, more institutions thinking like this, states thinking like this, governments, federal government thinking like this, wow, we will have a significant turnaround within our healthcare system. And that's what I pray for, and that's what I hope for, because like I always say, Joy, the Nigerian patients are worth it. Absolutely.
But speaking about the government, the state and local government, you keep saying you want health under one roof. Let's just dissect it for us a bit here. Let's understand what you mean by that.
Okay, so the key thing is about multi-agency, multi-governmental cooperation, collaboration, and partnerships. Okay, we want seamless service between all the levels. Okay, so for example, you have the primary care level, you have the secondary care level, and the tertiary care level. Primary care level is supposed to be for basic health care. Okay, by the time you're getting the kind of you're having a patient, or you're having patients who actually have care, the kind of care needs are actually higher than that, you need them to be referred to the secondary level care. Okay, by the time you're having patients within secondary level care that are having now more complex issues, okay, you need to go to tertiary care. Okay, now what I'm saying, we need that sort of seamless movement between them. At
the moment, it doesn't exist.
Oh no, absolutely not. Okay, everything is fragmented, significantly fragmented. And when things are fragmented, there are two things happen. First of all, you waste lots of resources, and number two, the Nigerian patients suffer a lot. A lot. Okay, so we need, and part of that, it just means all this multi-agency collaboration I'm talking about, coordinating things, integrating things, okay, and making sure that you actually throw in technology and leverage on technology.
Right.
Technology will make life much easier. Imagine if you had an electrical medical record system, for example, in the private level care that can talk to the system at the secondary level care. Okay, and when you're referring a patient to the secondary level care, they just go on their system. Oh, is this the patient? I was like, okay, that's fine. They finish with the patient. They want to refer the patient back to primary care. Just on that same sort of platform, use an electronic platform or digital platform. You just, hey, patient going back to you, we sorted the patient out.
You don't think it will be overwhelming considering what we saw with the glitches during elections? Never mind, I'm just trying to be a little mischievous.
Well, again, I keep using the word serious. Okay, right. when serious people actually throw in technology and they do it properly, okay, technology is fantastic. Okay, technology is how will I put it? It's like the you can use technology to jump things. True. Okay, technology is like the new age thing. It makes things faster, easier, better, safer, and simpler. Oh, I coined that in 2015. Oh, okay. I call it the FEPS principle: make things faster, easier, better, safer, and simpler.
And when you coined it, were you talking about the concept of technology?
I was just talking about making life easy. That sometimes things don't need to be difficult. Okay, there are simpler and easier ways of doing things. Let me let me use pidgin English here. For Nigeria, we just feel say things must hard first. No, things do not need to be difficult. Right. Okay, if things are done properly, things are organized properly, you build up systems that work and stuff like that, then the FEPS principle can truly come into play. Make things faster, easier, better, safer, and simpler. Okay,
and now let's talk about the affordability and accessibility of medical care. And my first thought is to the primary healthcare centers where it's within the local government purview, right? And it's really saddening to see that it's often in very dilapidated state, and we don't see as much medical workers.
In fact, Joy is almost a joke. That's the truth.
I don't want to be that there exactly. And yet these are the people who should be closest to the rural communities, and sometimes we see just one in miles. We don't see another one. So if you have to suggest a way we can revamp that sector, what would be your reaction?
Key thing, let me draw this. I'll keep going back to this 133 million multidimensionally poor people, and like you rightly said, these people are more in the rural areas. Okay, now you have about 9,000, probably maybe a little bit less, wards in the 774 local governments around the country. Okay, now one of the basic things that must happen, that should happen with primary healthcare, is that each one of those wards must at least have a primary healthcare center. Okay, now the primary healthcare system or whatever is domiciled with the local governments in Nigeria, and the local governments within the Nigerian space are almost non-existent when it comes to that capacity, be it in terms of funding, financing, in terms of the organizational power and stuff like that. You understand? Non-existent. And guess what? The primary healthcare system is the bedrock. Okay, is the foundation of any healthcare system. Okay, so that means that when I started initially, I told you one thing, that we have a very weak healthcare system, and we need system strengthening within the healthcare space, isn't it? So one of the key things that we must focus on, especially within the next 4 years, must be the primary healthcare system, because just delivering that sort of basic healthcare to those 133 million multidimensional people, vulnerable people. Any government that does that, if the next government that comes, they can do that and actually provide that, they have done a yeoman's job. Okay, so what do they need to do? Again, going back to some of the things I talked about, we need to actually make sure that we actually get data. Okay, the National Population Commission is going to be carrying out a census soon. Okay, so we need all that data, and of course we need to harmonize as well. Remember, we have that national identity management thing. We have all the BVNs and stuff like that. Even our PVCs and stuff like that. All this information needs to be harmonized. We need to know the different social classes of people, where they are and stuff like that, so we can actually plan, at least for the primary healthcare space. Okay, that's really, really important. Second thing is funding. Like I said, the local governments are too weak. Okay, now the federal government with its muscle must MUST get involved in primary healthcare. Okay, they must. There's no going around it. They must, and they must, and they must. Okay, so when it comes to funding and service, funding for that level of service delivery, they must get involved. Okay. Thirdly, the issue of the healthcare, the human resource for health, for example, the healthcare workforce. Okay, we must think innovatively in regards to that level of care. Okay, Nigeria does not have more than 45,000 doctors and on average, okay, for 215 million people and counting. Grossly inefficient, grossly, not enough. Basically, okay. So we now have to start thinking lateral and thinking innovatively. There's this policy called the task shifting and task sharing. Okay, now one of the things I care to tell people or anybody who listens to me is that when I talk about reforms in healthcare, I talk about it from the vantage point of the potential patient, not as a doctor. Okay. Not as a doctor who is thinking of, I'm thinking of myself, and my own people. No, I talk about it from the vantage point of a patient. Because guess what? In this, if you look at all the key players within healthcare, the most important player within the healthcare space is who? Is the patient. And guess what? All of us, ALL, will be patients at some point. All of us. None of us can escape it. Whether you're a doctor, you're a nurse, you're a politician, you're in the House of Rep, none of us can escape it. Okay? That's how important healthcare is. Is extremely important.
Exactly.
So one of the key things, innovation. Okay, we have what we call the community health extension workers. Okay, now what we want to see is some building of human capacity at that level. Okay, you can have, for example, within one of those primary healthcare centers, in those 9,000 wards. Okay, within one of those healthcare centers, you can have, I don't know what number. No, what number will satisfy a ward? For example, maybe like 6, 7, 8, 10. Because they'll be doing shifts and stuff like that.
Right.
And then you actually train these people and make sure that their training is competence-based training. Okay, you can actually train that cadre of worker for 2-3 years, okay, and make their training competence-based. Do you know what that means? That means that you're actually teaching them the real stuff in terms of delivery of care, not theory. Which is one of the major problems with our training, our educational and training system within healthcare in Nigeria. It is too theory-based.
Right.
Okay. One of the things I always jokingly say that the average neurosurgeon trained in Nigeria knows more theory and more book than me. But when it comes to actually delivering care and actually providing that care, doing that complex thing, within the brain and stuff like that, then they start to falter. Okay. So competence-based training for that cadre, community health extension workers, and make sure that training, okay, like I said, is competence-based, plus you throw in all the other key modules like leadership and management and soft skills as well, non-technical skills, teaching them the ability that ability to work within teams, communication skills and stuff like that. Okay, so that you won't have going to a hospital and someone say, "Turn your yash," they're giving you injection and stuff like that. These skills can be taught and they can be trained and they can be learned. So we need
this is all from the private primary health care.
Primary, of course, we need to deal with this. But I'm saying that within 4 years, if we can really concentrate lots of our energies.
I mean, I'm looking at it as a tall order, because we're in a country where local government chairmen are still fighting for financial autonomy in that sense, and there's no much they can do.
Reason why I say federal government must get involved.
The federal government
must understand that healthcare is that important. Remember, 17 Sustainable Development Goals, number 3
is health.
We need to keep reminding them again. Back to what you said before. Very sad that even the healthcare professional bodies, all of them, during the campaigns, were not standing on top of the people who were campaigning, standing on top of their head and asking them. In my own small circle, I kept posting in social media. I'll post on my and say, hey, can you people ask? I actually called the name of some of the key candidates and say, what is your strategy for healthcare? Okay, within my small level, I would have thought that maybe some people, some groups and stuff will actually pick it up and actually run with it. But sadly, okay, so again, back to primary healthcare. So you must actually sort out that human resource for health at that level, the community health extension workers, as I'm talking about, and make sure that not just about building their capacity in terms of training, make sure that they are well regulated. Because one of the fears is medical negligence, isn't it? If you create community health extension work, won't they start going and doing operations at the back and stuff like that? Again, back to the beginning when I talked about strengthening your system, strengthening your regulatory bodies, they must be fit for purpose. Okay. Now, the reason why I'm talking about this innovative idea is that you cannot get enough doctors to actually man your primary healthcare centers. So you must think innovatively. Okay. There's what they call local. You must think globally in terms of best practices, but you must look at your own special circumstances and domesticate.
I can only imagine how the dire statistics in a child mortality rate would reduce if we can have this revamping in that sector.
significantly. And of course, they will need supervision. So you cannot have like doctors, family, consultant family physicians, maybe at the local government level. Do you understand? Now overlooking them. Of course, you throw in technology again. Okay, a community health extension worker is in his primary healthcare center somewhere. He has a patient. This is a little bit more complex. Do you understand? Go on the system, chop, make it for call the doctor. Doctor says, "Oh, show me on video." See, technology. We are in that period of artificial intelligence. Leveraging on technology will make us gallop, okay, and make significant, do you understand, strides within healthcare, especially within our primary healthcare system. Okay, so we should not be afraid to actually make these things happen. You're talking about something being a tall order. It is not a tall order if you have governments at all levels and all the key players being serious about it, understanding them. Hey, can we let's repent and start understanding that healthcare is a fundamental issue and it is that serious.
Well, Dr. Douglas,
because Nigerian patients are worth it.
Exactly. But are you also concerned about this trend of medical tourism, especially among people who can afford it, of course? But is it concerning for you that our political actors can decide to travel at will? Our president set precedent in that, and so we've seen it over and over.
Of course, for someone like me who is passionate about my country, who's passionate about reforms in Nigeria, and left the UK, left a place like that where you have all the equipment, good place, light and stuff like that, good roads and stuff like that, and came back here. Of course, it saddens me to my bones. Okay, and that is why again we need everybody to be putting pressure, okay, and asking the key questions. It's just like, for example, the House of Rep chap that was trying to put forward this very simplistic, nonsensical bill and stuff like that. You ask people like that, for example, where are your own children? Are your own children going to school in Nigeria? When you have healthcare needs, the doctors you say you want to actually put for 5 years in Nigeria, are you going to stay back in Nigeria, okay, and actually access care with them? Again, so it goes back to actually doing this thing holistically and going down to the fundamentals, thinking strategically, pulling all the key people together, and actually running this thing together with everybody being on board, okay, and understanding that once we put in the work, because there's work to be done, we can achieve great things. Right. Okay, we just need the right mindset. Okay, the mindset of that honorable member in the House of Rep, his mindset is in the wrong place. That's not the way to do things.
What would you rather he does to curb this?
All the things I've talked about previously.
I mean, yes. it's quite dire. Yeah. With the way, if you watch his video, I mean, he went on and on churning statistics. And
all the statistics were wrong. He talked about that Nigeria has less than 10,000 doctors. Where did you get that from? So first of all, you think that you're actually portraying a sort of picture that you're for Nigerians, but no, you just ended up embarrassing yourself. Okay, because clearly you did not do your homework, you did not do your research, proper research, you did not actually do the proper consultation.
So what do you think, that we have more than 10,000 doctors?
But I just told you, we have roughly about 45,000 doctors, 45,000 doctors.
Right.
Yes, within the country. And of course, it's nowhere near enough. But what I'm saying is that coming and spilling out wrong information, okay, first of all, it just shows that, this gentleman has not done a proper job. Okay, you just come and do some wishy-washy stuff and just talk. There's some people clap. No,
is 45,000 doctors enough for a country such as ours?
Absolutely not.
But so you do admit that there's a lacuna there. There's something.
There's a lacuna everywhere. Not just about doctors. Remember, I'm trying not to. So if you want to talk about healthcare, the healthcare workforce, let's talk about the healthcare workforce. Okay, nurses, medical lab scientists, radiographers, physiotherapists, okay, midwives, doctors, dentists, okay. You do not have enough of any of them at all, and you need all of them. All of them they are all important. You need all of them. You cannot do without any of them, because what we call the multidisciplinary team. Okay, providing healthcare that is what is sought, that with some quality and safe healthcare, requires the whole team, okay, working together properly, requires everybody within that team, all the nurses, people who have actually created proper working conditions for a proper working environment, not a toxic environment, remunerated properly, okay, trained properly as well. Okay, that's what you need for all the healthcare workers, not just one of them. Please, can we please stop picking one healthcare worker? Okay, the doctor seems to be the poster child for healthcare, but no, healthcare is not about doctors. The doctors are just one of the healthcare providers. Please, ladies and gentlemen, If you don't remember anything in this whole debate, remember that healthcare is not about doctors. Healthcare is about a system that is supposed to actually provide quality and safe care, especially within the Nigerian domain for Nigerians.
Okay, before I let you go, reactions. One of the reactions that came after this proposed compulsory 5-year service was that some Nigerians were threatening to sponsor a bill that would ensure that public officers do not travel out for medical services. Do you think that bill will see the light of day?
You know how this is. It's usually tit for tat, isn't it? Oh, you've done your own. Oh, we'll do our own and stuff like that. Again, okay. It's all. Can we focus?
But is it worth it? I mean, when you see the exodus of our
okay. So first of all, okay, you cannot stop an individual. That was another major problem. It was trying to infringe on the fundamental freedoms. Do you understand? Of a particular set of healthcare workers. That was what the major problem was. So the same thing, you cannot infringe on the freedom, for example, of a lawmaker or a house of rep or say, oh, I want to go to Germany to actually get care. But you can say, oh, not with government money, not with the people's money. Okay, if you have your personal money to actually go, why not go? But not with taxpayers' money.
We're talking about politicians in Nigeria that are career politicians.
Well,
very often they have no money than the people's money.
Well, so again, so if such a legislation will be put forward, oh, I will totally support it.
Okay, Dr. Douglas Okor, I must thank you for being part of the program. He's a consultant neurosurgeon, Federal Medical Center, Abuja, also a Nigerian health sector reform advocate, and we've been discussing the healthcare infrastructure, challenges, opportunities, and reforms. Thank you so much for being part of the program.
Thank you again, Joy, and thank you, KAFTAN TV, for having me.
It was our pleasure, I must tell you that. But this is where we draw the curtains on Joy Asonye Live today. We'll be back tomorrow with more. Have a wonderful evening.